For those suffering from it, irritable bowel syndrome and celiac disease can be debilitating. IBS affects more than 25 million people in the United States. April is IBS Awareness Month, so we checked in with Dr. Tuyyab Hassan from Holyoke Medical Center to learn about the treatments and options for people living with IBS and celiac disease.
So irritable bowel syndrome is basically what we call a functional disorder. And what that means is it's not really a diagnosis you can make with an x-ray or a blood test. It's based on criteria of symptoms. And usually those symptoms tend to be, bloating, abdominal discomfort, go between diarrhea or constipation. And usually, when you have a bowel motion or you pass gas, that actually gives you some relief. So those are the main criteria that we use for irritable bowel syndrome. Unfortunately, it's not a very, sexy topic in the GI world. It's not like colon cancer, celiac disease, or those other types of things like Crohn's, because you can't really diagnose it. And it's like, people can sometimes have nebulous complaints or symptoms, so it can be very hard to diagnose sometimes.
And people could be living with it for years and not realize it?
Exactly, yeah. And I've seen patients who've had symptoms for 10, 20, 30 years since they were kids, and it's finally somebody convinces them to seek some help, and we get to the bottom of it, and they feel reassured that all this time, they've been living with this horrible set of, ailments, and we get to the bottom of it eventually at some point.
And so what's the treatment for it? How do you help people?
Unfortunately, there's not really a cure for this. And again, that's another reason why it's not such a sexy disease. You just can't cut something out or take a magic pill and it goes away. So most of the treatment aims at the triggers of IBS, the things that make your symptoms worse. And that could be diet, it could be something you're eating in your daily life. It could be relationship issues with stress as a component, marital problems, job issues. And then it can be other things like an imbalance in bacteria in your gut. It can also be, genetics, if there's a family history of IBS, parents have it, brothers, sisters, and that can run in families as well. But unfortunately, we don't really understand the exact mechanisms of it. All we do know is that there's a very close link between the brain and the gut. And you can think of the gut almost like it's a small brain. You have two brains, a brain in your head and a brain in your gut. Mm-hmm. These two brains are talking to each other all the time. And if one gets disturbed, the other one feels it.
Really? And do you have to rule other things out when somebody comes in and says, these are my symptoms? I mean, clearly it could be something else as well, correct?
Oh yeah, definitely. And that's why you want to make sure you see a doctor and a person that has time to listen to your complaints, because there are some other conditions that can masquerade as irritable bowel syndrome, like inflammatory bowel disease, celiac disease, bacterial overgrowth, and God forbid, in rare circumstances, cancers or malignancy. So definitely you want to talk to your doctor or talk to a GI person and make sure that nothing else is going on. And there are some alarm or red flag symptoms that you want to look out for, like if you have blood in your stool, if you're losing weight, poor appetite, if you're just feeling unwell, fevers, chills, anything, make sure you see somebody about that and get it checked out.
And typically, who does it affect, and what are the ages?
Commonly, most of the people that have IBS tend to be female for various reasons that we don't quite understand. About 2/3 of sufferers are female, 1/3 are male. It can affect any age range. It's less common in patients in their 50s. Just having new symptoms at 50 and older should spark some concern for other things. But having said that, like I mentioned, people can live with it for many, many years, and it could manifest to their doctor at the age of 60, but they've had it since they were in their 20s. Mm-hmm. So those are types of populations that we, but any race, any ethnicity, it can be anybody. And
how does this affect people? I mean, you think about traveling and you think about work or going to school. This has to be debilitating in a way and make people nervous about, where they're going and how much time they're going to be there.
It's horrible. It's a horrible condition, and it's a spectrum of disease. It can be mild and moderate, and that's probably the iceberg that we don't see. And the people just manage it and they just deal with it. Or it can be really severe. Now, people can go into the bathroom numerous times a day. They can have bloating and discomfort. A common thing, people come to, I look like I'm 30 months pregnant, and doctor people, it's embarrassing. So there's many different ways it can present, and it definitely affects work, quality of life, and that's where we try and sit with the patient and try and help them get through that and control their symptoms.
And how do you work with different strategies for that? Because people who might have to go on a long car ride, or maybe they're going to take a 5-hour plane ride, might be really concerned about that.
It really depends on what the predominant symptoms are. And sometimes, like I mentioned earlier, if it's a diet thing or if it's a bacterial thing, we can maybe help with that with antibiotics or we can give a diet plan, avoiding certain types of carbohydrates, what's known as the FODMAP diet. So these small carbohydrates are not absorbed very well by the gut. They ferment in there and they cause gas, bloating, distension, diarrhea. So, it's different. It really depends on what the main symptoms are as to how we individualize the treatment for that patient. So one catch-all, maybe not for everybody, but sort of individualizing it out.
But it also has to be hard for them too if they had to talk to their employer, the reason why they're out or different issues. It is a topic that people probably don't want to discuss. It's embarrassing.
Yeah. And it's not an issue. I think a lot of employers, we can give them like a letter for their work if they need more frequent bathroom breaks. And usually I found that employers are receptive. They're not going to penalise employees for that. If they do penalise you, maybe that's part of the problem. Maybe they're a malignant employer. We need to change employer,
So the other issue coming up, I know May is Celiac Disease Awareness Month, and that is also something that you also deal with as well. Can you explain what that is?
So celiac disease is a problem with gluten. Gluten is a type of protein found in wheat and rye and barley, and your body essentially recognizes a foreign invader. It stimulates an immune response, and those cells start destroying the lining of the small bowel. And that can have terrible repercussions for people. It can even increase your risk for types of cancers. We'll call lymphomas, which are types of blood cancers. But it can affect kids with their growth, with their seizures, attention deficit disorder, depression. There's if I told you all the things it can cause, we would be here for a long time. But it's certainly something, it's part of the workup for the IBS. And it's a blood test you can diagnose that with as well.
And do you think that people also are living with that sometimes and don't realize that they have that issue?
Definitely, yeah. There are definitely a lot of people that have celiac disease and they don't know it, or they're not paying attention to their body. The body's telling them and they're not listening to it, And it's just a simple blood test can help us to tell whether or not you have celiac disease.
And you were mentioning some of the other long-term effects. You said that it could lead to some types of cancer, diabetes as well. Is that also a risk?
No, it's not. So it doesn't really cause diabetes, but it can be associated with type 1 diabetes, which is where, again, because celiac disease is an autoimmune phenomenon, meaning that the immune system is out of whack, then other parts of the immune system can be out of whack as well. So, diabetes, thyroid problems, skin disorders where the immune system can attack the skin as well. So all types of things.
What's the best advice for people who are experiencing any of these symptoms that you've described?
Talk to your provider, talk to a physician, a GI doctor, and make sure that physician listens to you. I think that's the most important thing. If that physician doesn't have time for you, then you need to find somebody who has time for you to listen, because some of those complaints you can't be dealt with in 10 minutes. Sometimes you need 20 minutes or 25 minutes to sit down and dig. So it's almost like Sherlock Holmes and investigating what the triggers are and what's going on.